Hello, this is Steve Klasko. For those of you who don't know me, I am the North American Ambassador for Sheba Medical Center and ARC, which we'll talk about in a minute. And I'm also the Executive in Residence for General Catalyst. And as things go, had a very strong relationship with Microsoft when I was the President and CEO of Thomas Jefferson University and Jefferson Health, which was the largest health system in Philadelphia. And I am thrilled, and this is really exciting for me and for all of you, to be here with Ruthy Kaidar from Microsoft. And Ruthy, might be really cool to talk about just where you come from and what you do for Microsoft.
Of course. Well, first of all, thank you for being here. It's an honor. Also for me, it's very exciting because of the great partnership we have with Sheba, with ARC, and also, in the United States with various health organizations. I lead Microsoft's healthcare business across EMEA, so Europe, Middle East, and Africa. Which means working with health organizations, health providers, hospitals, health payers, HMOs across 120 plus countries. And of course, I'm based in Israel, so my heart is here. And it's really a pleasure and an honor to be partnering with Sheba and ARC on various innovative projects that we run together. And it's kind of like our home base for doing a lot of great work together.
Yeah, I want to get into that a little bit
Okay.
because that's what I found. Having been the CEO of 3 different health systems in the United States, I always had to convince the people under me that innovation was important.
Yeah.
In fact, a lot of them used to call it Steve's hobby.
Okay.
And I was always viewed nationally, oh, Steve's a disruptor. Until you come here, right?
Right.
And that's disruption of the traditional health system is 9 a.m. So how it would be interesting to hear from you how you reconcile that across different parts of your empire of EMEA, but as an Israeli.
Yeah, it's a really good question. So I often try to bring that Israeli disruptor innovative mode into various countries across EMEA. And it's a very fine line because you have to respect the culture and the speed and the aspects of the system and the people that you work with, but also kind of nudge them towards leaving their comfort zone. And I think that's what I consistently try to do. First of all, it's like something that's burning in me. So it's like I can't see an opportunity in front of me where, a healthcare organization can transform and not show them how they can transform. So, and of course, you need to find those change makers in each organization. Also in Israel, there are organizations that innovate more than others. It depends on the people. It depends on, finding, the right project at the right time. So I think that connection to the people and to the change makers and to the innovators in each organization is key to really succeeding and transforming.
Which is, in a way, an interesting connection with Microsoft. And, I'm 70 years old, so I actually was one of the first advisors for Apple in digital health, believe it or not, in the
Wow.
early 2000s. And Microsoft was, frankly, a very different company
Very different.
back then.
Yeah.
Always a great company, but, Apple was sort of the disruptor. And that's really, really, really changed.
Yes.
And I think what would be interesting for folks to hear about is it's amazing what Microsoft and health are doing together. And I just know from my Jefferson time, especially with your acquisition of Nuance and some of the other things that are happening, your willingness to sort of bring the human and the technology together has really been an amazing differentiator.
True. I joined Microsoft 10 years ago, right when our new CEO, or not new anymore, became CEO, and coined our mission, which is to empower every person and every organization on the planet to achieve more. The beauty of that mission is that really it's present in everything we do, in every product choice we make, in every discussion we have with a partner, with a customer. And that's why I wake up in the morning. Because in healthcare, that mission becomes, reality. Because you bring technology, but technology is just the means, right?
Right.
You really bring a system, a platform, a technology, or an idea that transform how a clinician, performs a clinical meeting with a patient. instead of having to type the whole meeting, why not have an ambient, like what we're doing with Nuance? Why not have an ambient listening system that transcribes the whole discussion and takes only the medical content and puts it into the electronic medical record? And these things change people's lives. It changes the doctor's life. It changes the nurse's life. It changes the patient's life, right? Or anything around data, right? Just the fact that there's a platform and we can connect the data and suddenly have a 360-degree view of the patient that sees not only the disease they came to the doctor to see, but their whole 360-degree view of their well-being and other pathologies that they're facing. So these are the things that really make a difference, and that's where we want to be.
Yeah, and living that vision, I had a chance to have a meeting with your CEO when I was at Jefferson, because we're building a new outpatient center and we wanted all the cool new things. The thing about building a new building, which we started like in 2021, will be open in 2024. If you're not thinking 5 years ahead,
exactly,
then you're already behind. And it was great that Microsoft was willing to think like that with us. But it hit me that one of the things is that we've spent about 15, 20 years, in essence, and I'm speaking about myself, lying to our doctors that technology is going to make their life easier.
Yeah.
Starting with electronic medical records.
Yeah.
I know it's going to cost us $300 million. You're going to have to come back from, but it's going to make your life easier. And, I kid around that EMRs are probably the first technology in history where you need more humans just to get back to where you are. What hit me about what Microsoft is trying to do, and I'm curious as to how your physicians you talk to and others, they recognize that, and they're really trying to take data, put it together using Gen AI and other things. So it's not replacing what
Right.
physicians and nurses do, but like literally becoming your best friend,
Right.
and making you better at what you do.
Right. So we call that the co-pilot, right? That's why we're talking about empowering others and serving as their co-pilot, because we don't want to, we don't think technology can really replace a doctor. We think that it can help the doctors. I've heard a statement say, AI will replace the doctors that don't use technology and you don't use AI. So, and it's true, because there's so much data out there. There's so many parameters to take into consideration. There's so many research papers. There's so many innovation happening in clinical practice that if you're not using technology to be on top of that, all that information, it's hard to practice to give the best clinical practice to the patients. And I think also we meet with a lot of medical universities that tell us that the way they teach medicine is actually changing, because you need to bring this digital technology and look and how to use EMRs in a more efficient way, how to bring automation, right, into EMRs or into any technology system that you use. So this is where we see the technology kind of ramping up really quickly.
So I want to go from California to Israel, but I couldn't agree with you more, by the way, about the human. I think a lot about the human in the middle when online meets offline, and I was on a panel where somebody said, I think technology is going to replace 80% of what doctors do, and I remember saying something like, well, look, any doctor that can be replaced by a computer probably should be, but I think the whole concept of starting to select and educate docs, not around being able to memorize the Krebs cycle, but being able to be better humans than the robots instead of better robots. But here we are at ARC, and just like people probably that are just out there with their Microsoft computers and everything that they've loved Microsoft for, don't understand everything you're doing in Gen AI and health and around improving people's lives. People even that know Sheba don't really know Sheba, right? I mean, they might know that Sheba is a top 10 world health organization, the largest health system in Israel. But really what you and I have gotten involved with is ARC.
Right.
And ARC is global.
Right.
And ARC is almost, in some respects, the opposite of what I was used to running large health systems. And when I say that, in large health systems, we have in my case, we had a university, and we have our 18 hospitals. And it's often, oh, by the way, we have this innovation pillar.
Right.
If you could talk a little bit about your relationship with ARC, because in my mind, ARC sort of drives Sheba and is innovation as the driver, and everything else is basically how do we use that innovation?
Yeah, I really like the way you positioned it, because it's true, because in a way, the innovation here really drives the transformation and the adoption of technologies in the hospital, but also in other places in the country. So our partnership with ARC is really, first of all, we've been partners for many years. We're technology partners, we're business partners, we're kind of design partners. Some of our products, our healthcare platforms, we use ARC and Sheba as customer zero, kind of like a startup would, because we like to work in this agile, dynamic way that ARC works in. I think just the fact that we can sit together and identify market needs, identify either clinician needs or patient needs, and think how technology can answer that, and how we can work together towards solving a problem together, how to bring the technology together to make a difference. And I think maybe the most important point is the people. The fact that the people within Microsoft and within ARC work so well together, and the fact that we're so aligned, we think in the same speed. I think that's also a very, very important factor in why this partnership is so successful.
Yeah, and it just seems like the optimism around healthcare because of that innovation is different here. And what a lot of people don't know is ARC really is global. We have partnerships with Deloitte around the world. We have this thing called Future of Health, which is about 50 health systems and others that get together not only once a year, but really talk about things like, where do we really take population health, social determinants, predictive analytics from philosophy to the mainstream of clinical care and payment models that people in the past, we can't really talk about that because that's too complicated. It seems like because of the partnerships we have with Microsoft, with pharma partners, it's almost like nothing's too complicated. We're willing to talk about it.
I totally relate to that, because I think that global network of ARC together with the global presence of Microsoft is so powerful. And we see it in almost every project that we do, because it's not only, okay, let's see how it works in Sheba. Let's see how a project that we run is now running in, maybe 10 other hospitals around the world. And our teams around the world want to see what's happening here. We have many organizations that we're partnering with ARC and actually want to come here and learn how to build innovation, how to work together, how to partner. So that global connection works both ways very, very well.
So I want to bring things up to December of 2023. I flew out here 2 days ago, and folks said, "Wow, you're coming to Israel." I'd like to talk a little bit about your view of here we are at ARC, and I just talked to my family, and I said, look, our goal at ARC is to improve lives, is to improve health. That doesn't change. That doesn't change based on what's happening. We were, as you know, Sheba was one of the first places to respond to Ukraine. We're looking at innovation around healing. So, talk a little bit about the importance of having, whether it's folks like myself here or folks like yourself with Microsoft here at this time, what that means to people, not just in Israel but around the world that want to see a better day.
Yeah. Look, I think the nature of the people here is that we want to immediately help and volunteer into making a difference. I think what happened after October 7th is that every single person, first of all, was either drafted or had a family member drafted or impacted, and immediately wanted to volunteer, help, put in whatever they can individually to help the national effort. First of all, from a Microsoft perspective, we identified that really quickly and tried to centralize all the efforts into one concentrated effort. We have this disaster response kind of entity within Microsoft, which we also used in Ukraine, to make sure that we can at least make sure that all the technologies are in place, especially around cybersecurity, privacy, and so forth. Think about all the volunteering entities here in Israel that are that made a lot of the difference in the first weeks, and still are making the difference in the first weeks and months of the war or the conflict, and just making sure that they're secured, that the privacy is secured, that geolocation is not exposed. So we really try to centralize the efforts there. The other aspect is how do we take partners that we work with, like ARC, and we accelerate projects that we're working on to help the immediate needs of the people. And that is something that happened quite quickly here with Sheba and with ARC. Because there were a lot of projects that we were working around digital health and bringing technology and innovative technology and Gen AI into various aspects of clinical care. But we very quickly identified projects that we can help the nation immediately. Anything around symptoms checking and triaging, anything around mental health, and bringing digital and remote care to different people within the country. So, and especially now with generative AI and OpenAI and Azure OpenAI and its ability to, work also within the confines of the organization, the healthcare organization, our ability to really work closely and very fast and agile together with ARC is allowing us to move very fast together. I think the dynamics and the agility of the team here and the process that we created to create traction very fast, I think that is also another aspect of why we're succeeding in delivering solutions very fast nationally.
And I think what's really exciting for the people that are listening to this, just as the partnership with Microsoft and ARC and some of the pharma partners during the pandemic, I think this immediate reaction and call to action that is right now helping people that have been hurt through this will have impact when the war is over, and will have a huge impact on improving lives both in Israel and around the world. So I have one last question. This is all about the future. We're sitting here, and yesterday was my 70th birthday, so let's assume that, thank you, let's assume that I'm now 75, and I'm probably going to need more healthcare than I need today. So what are we talking about in 2028, in December of 2028, that we're saying, God, Steve, I can't believe back in 2023 this was still true. Yeah. What's changed the most?
First of all, taking away that laptop or that computer between the clinician and the patient. I think that's the first thing. Any AI technology around voice to text, transcription, even radiologist transcription, right? Just not needing so much repetitive work and
no layers, right?
No layers, right. Yes, exactly. And administrative work that can be saved, and just allowing people to really do clinical work, to work with people. So I call it, removing anything that takes away your face-to-face patient time. So that's one thing. I think the connection of data. So data is very siloed because it's sitting in so many systems, and the fact that we can just, at one click, just see all the data that you need, either about a patient or about population health or about a certain layer of a disease or a pathology. That, is something that I'm sure would streamline. And one thing maybe to really highlight around generative AI and OpenAI is that anything that's textual can be actually suddenly, used to extract insights. Right. So extracting insights quite immediately is going to make a huge difference.
So it's fascinating about that future, listening to you and realizing what Microsoft and ARC will be doing together. In some respects, this technology is going to allow us to be more human, right? I mean, I think we all talk about workforce transformation and sort of little depression that's existing among clinicians and stuff. And I think back to my white coat ceremony, my third year medical school, getting that white coat, knowing that I was going to be able to interact with people is what got me excited. It wasn't, what my computer was going to do. The fact that Microsoft is going to be able to use this technology to actually allow me to get back to what I thought about when I was third year medical student is really pretty exciting.
Yeah, and allowing you to be, to treat every patient differently according to the data that you see about them, to, have that more, close interaction. Maybe you'd be able to spend more time with each patient.
Well, Ruthy, all I can say is if we could bottle you and ARC, I think not only would we improve lives, but healthcare would really change. In the United States, I often use this quote because, things don't change as quickly as I'd like. In the NBA, there was a point guard named Jason Kidd who went to the Dallas Mavericks, and they were 24 and 52. He said, I'm going to turn this team around 360 degrees.
Yeah.
We do a lot of turning things around 360 degrees in the traditional system.
Yeah.
Neither Microsoft nor ARC is looking at things that way. You guys are looking straight ahead into a very, very, very different future.
Yeah.
And I couldn't be more excited to be part of that future, certainly from the ARC side and hopefully in partnership with Microsoft. So thanks for joining us.
Thank you.
And this is really a lot of fun.
Thank you for your support and your partnership. It means a lot. Thank you.